Can you give us an update on where you're at in PNG, where the threat is and how we're going combating it with the vaccines from Australia?
Sure, thanks. Good morning, Peter. Yes, what we're seeing on the ground in Papua New Guinea is an exponential increase in the number of infections, as you've just highlighted. Over the last week, about 1,500 new infections and unfortunately around 40 deaths since the beginning of the year. MSF is really seeing strong evidence of sustained community transmission. Around 40% of the people who are presenting at our testing facility in Port Moresby are testing positive for COVID-19.
It's going to get worse, isn't it, Simon?
Will get worse. What we're seeing is really the tip of the iceberg here, Peter. All the indicators are that the situation is already community transmission, and that means that we have to fight this on a number of fronts. So whilst it's really important that people start practicing social distancing and that we're able to increase our testing, we really have to now look at how we're going to prevent those serious illnesses presenting at hospitals and how we minimise the casualties from this horrific outbreak.
Yeah, hospitals. How are the staff members? How are the nurses, doctors doing?
Well, that's been one of the major concerns, one of the major challenges over the last week. We're seeing a number of health workers in the public health system, and there are roughly 30,000 frontline health workers in Papua New Guinea that need to be vaccinated immediately if they're not to get the illness and to be able to continue to turn up for work.
Well, and that takes time.
It does take time, but there's a quick solution right on Papua New Guinea's doorstep, and that's the stocks that we have in Australia that could be mobilised immediately.
How many are we talking? What do you need?
Well, the Australian government's been generous this week in sending in over 8,000 doses of our AstraZeneca vaccine from Australia, but we really need closer to 30,000 doses this week to start getting those frontline health workers and ancillary workers vaccinated. That sounds like a lot, but Australia is currently sitting on more than 1 million doses of AstraZeneca vaccine, and sending them up to Papua New Guinea would take a matter of hours. We could really start solving this today if Minister Hunt and Minister Payne took the decision.
There is still an order in from AstraZeneca from the European Union as well of 1 million doses. Are you banking on that at all, Simon? It doesn't seem like that's going to come through, given what's going on with vaccine nationalism at the moment.
Exactly, Peter. Vaccine nationalism has been a major constraint globally in getting the vaccines to the most affected areas. Countries like Australia have been hoarding vaccines, whereas countries like Papua New Guinea and a lot of the other places where MSF works globally are desperately short. They've received no vaccines, or their vaccines aren't due to arrive for a number of weeks. As I said, the 1 million the 1 million doses you mentioned stuck in Europe at the moment is really a bit of a moot point. Australia's producing AstraZeneca vaccine down in Melbourne at CSL, and we're producing 1 million doses a week. Surely we could spare another 20,000 doses to go to Papua New Guinea straight away.
And just on that new strain that I was talking about from PNG, what's your thoughts on that, Simon? Are you worried about that one?
Listen, of course, we're seriously worried globally about the evolving strains of COVID and those that seem to have stronger transmission rates. However, the best way of fighting this, Peter, is to vaccinate as many people as early as possible, and that'll stop these new variants evolving, giving them time to mutate. So in the case of PNG, yes, some concern that there's some new variants being detected, but we still have a window of opportunity over the coming weeks to mitigate this problem and to prevent further spread and further variants emerging in Papua New Guinea.
Okay. Simon Eccleshall, the head of programs at Medicine Sans Frontiers, or Doctors Without Borders. Thank you, Simon. Appreciate your help, your time this morning. Doctors Without Borders do a terrific job, not just there, but right around the world.